Good morning, Dan and Amy, talking Hillary's health. And by the way, don't listen to me when I say these are legitimate questions, particularly if you're inclined to disagree with the center-right perspective on candidates and policy and politics. I'll defer my time to Josh Earnest, the Dickensian-named White House spokesman.
The president's opinion on this, I think, can be judged based on the way that he has handled this question when he's been president, and he's arranged for his physician to communicate information to the American public about his health. So I think those are entirely legitimate questions, but how they're answered is something that the individual candidates have to decide for themselves.
Well, that's it. So they're legitimate questions. And again, we have talked about on this show the standards that are previously set by previous presidents when they were candidates on both sides. Bill Clinton in 1992, when he made his doctors available for questions to be asked by the New York Times and others, and he disclosed medical records. He was a little resistant, but he ultimately did it. Wide-ranging medical records, including some embarrassing bouts he had with hemorrhoids and things like that.
Yeah, that go in the TMI category.
Well,
but I mean, it was a condition.
But erring on the side of disclosure, which you have a responsibility to do as a presidential candidate.
And I watched John McCain. I watched file video of that yesterday, and the reporters filing in, sitting at tables, assigned seats, and just plowing through all his medical records, and then somebody there making sure they don't take him out of the room.
1,000 pages of medical records that John McCain released. Bob Dole, 72 years old, when he was a Republican candidate for president in 1996, same thing. Legitimate questions about his health and his capacity, and those questions were asked and answered, and then the issue went away. That's a different choice than Hillary Clinton has made. And, of course, there's a lot of diagnoses from afar. And so let's get an informed second opinion from, how about somebody that's a doctor in the area of neuroscience? We're pleased to be joined by Dr. David Frim. He is a professor of surgery, professor of neurology and pediatrics, and the chief section of neurosurgery at the University of Chicago Hospitals. Dr. Frim, thanks so much for joining us. Appreciate it.
Oh, you're welcome.
So before we give you our half-baked theories, and we'll get to those, but why don't you give us a fully baked assessment, your fully baked assessment from afar, admittedly, but your assessment of everything you've seen so far from Hillary, as well as the explanation she's provided for particularly the incident over the weekend.
So first I should say I'm a neurosurgeon by training, and pneumonia and collapsing, those sorts of medical problems are a bit out of my area of expertise. But I think that some issues have been brought up in areas of my expertise, such as head injury or head trauma.
Right.
But I watch TV, I guess, like everybody else does, and I think both candidates seem to be very energetic, and they seem to not have any of the stigmata that one would have of incapacity. They don't seem to have problems with memory. They don't seem to have problems with movement. It's just watching on TV. You can't really say much more in specific because I certainly haven't examined anyone. I haven't looked at any records. I think I'm just an observer from afar here.
But can you pass out? I mean, can you have paralysis? Because it looked as if her knees buckled and she couldn't have control of her feet. Can that happen from dehydration and being overheated?
Certainly, if someone is hot, is dehydrated, they can feel faint. They can feel unwell, vomiting, nausea, all sorts of symptoms like that. That would be very reasonable.
Well, there's been some supposition about underlying conditions that Hillary Clinton may have. I'm not suggesting she does. I don't know. But there was a metal piece, it appeared, from video, that close-up video that was taken on Sunday. There seemed to be some kind of metal piece or metal device that fell from inside her pant leg when she kind of collapsed and had to be dragged into the SUV that was waiting. And we had one email from a nurse that suggested, again, she doesn't know, but she's just making a suggestion that there are these seizure alert devices that persons with epilepsy have that can alert them to an oncoming seizure, and perhaps that was a piece or that was a device. Is that a possibility?
I suppose any question you start with, is that a possibility? It's a difficult question to answer. I didn't see that video, and so I can't really comment specifically about it.
But there are such devices. Is that
there are not specific devices that are so good at detecting a seizure that you can have it set to give some sort of treatment. But there are things that can be used for detecting surrogate things, like changes in heart rate or changes in blood pressure.
so monitoring devices essentially?
That's correct.
All right. So, according to Hillary Clinton, she told Anderson Cooper that she's taking antibiotics to take care of the pneumonia. Should she even be around people? Is that contagious? I know she went to see her grandkids right away because she said grandkids are the best medicine. But is she infecting other people?
My guess, and it's not a particularly educated one without knowing any of the information, is that she may have overextended herself, as she says. There's many reasons that someone can get pneumonia, and it's unlikely that would be contagious in that situation. More a reflection on things going on in her life than catching something that she could give to her grandchildren. Presumably fluids and antibiotics and some rest, that would probably be the easiest way to treat that.
Another theory that's out there, and again, we're just trying to address theories with as informed opinions as we can find, is that she may have an underlying condition such as Parkinson's disease. And one of the arguments that's been made, including by at least a couple of doctors I've seen, again diagnosing from afar, which is always dangerous, but the indicators such as these blue sunglasses she wears, and that I guess blunts the impact of Parkinson's in some material way by the way that light is received. Is there any veracity to such a suggestion as, again, a possibility?
So again, we're diagnosing from afar by watching on television. So I'm not sure that one can say anything definitive about that.
No, it's not intended to be definitive. It's speculative, but I mean, is that something that Parkinson's sufferers use? Is that a legitimate supposition?
I think, given the way she looks when she is moving, given the way she speaks, I think it would be very far-fetched to come to any conclusion like that. But again, we're all looking from afar.
Well, walk through some of the symptoms of Parkinson's.
So Parkinson's is a disease in general that we think of movement, lack of fluidity of movement, and then it can progress as time goes by to further impairment of movement, of balance. And there's a particular way that people with Parkinson's, as it advances, walk and move their extremities. Certainly that would be, in general, evident as the disease progresses. And she doesn't seem to someone watching from afar to look particularly that way. So I think it would be very difficult to draw a conclusion in that direction.
Now, back in 2012, she apparently became dehydrated and fell inside her home, and there was bleeding on the outside of the brain. Could that have a lasting effect and hurt her in the future?
So if it's very severe, a lot of bleeding that's affected the brain, one would imagine that it could, but that doesn't seem to be the case, at least as far as I could tell from my brief scanning of some of the news reports from that time. She seemed to not particularly have any injury and to recover very well. So I think that's, again, something that would be very far-fetched to conclude.
All right. He is Dr. David Frim. He is a professor of surgery, professor of neurology and pediatrics, and the chief of the section of neurosurgery at the University of Chicago Hospitals. Dr. Frim, thanks so much for joining us. Appreciate it.
Oh, you're very welcome. Have a good morning.
You too. And he joined us on our turnkey.pro answer line.
This is the